And good afternoon. It is time for our weekly Lunch and Learn with me, Dr. Polly Heil-Mealey at Abundant Health and Wellness. Now today, we're going to talk about contact tracing because it is all over the place. I don't know if you know, but on your phone, depending on what version you have, depending on if you've got an Android or an iPhone, you already might have health trackers on your phone. I'm going to tell you a funny story. My daughter has Life 360 app on her phone, and she asked me if I wanted to have that on my phone, and I thought, okay, why not? I don't know. If you want me to have it, I guess I need to have it. Well, a few years back, I was keeping her children while she and her hubby went on a much-needed couples-only vacation, and we had taken the grandchildren to see my father. And we were having a good time, and all of a sudden, into the driveway comes my daughter, and they were supposed to be on vacation for another day at least, overnight and the next day. And I don't know how, and I wondered, I said, how did you know I was here? She said, I had it on your app. And so I thought that was funny because she could track me down by knowing where my phone is. And while I don't mind my daughter knowing that, I don't want the general public knowing that. Not because I'm doing anything that I'm ashamed of or I'm embarrassed of, but quite frankly, it's none of your business where I am. And so I'm a little bit concerned about these contact tracing apps. And so if you have downloaded on your iPhone, I have an iPhone, and iPhone for the past, I think 3 weeks has been wanting me to download the new version 13.5, which does have contact tracking software on there, and I have been avoiding downloading it because I don't want to download that app on my phone. I have been told that once it is downloaded, you cannot download it or disable it. I don't know if that's true or not. I'm just erring on the side of caution. One of my assistants happens to have an iPhone 11, and that app is already built into the software, and so she was really upset because she doesn't want people tracking her and that kind of thing. And so it's just one of those things that, you know, if it's not on there, I don't know if you want it on there. And they're telling us on the news and whatnot, it is to contact people who may have been exposed to COVID-19. And that may or may not be true. Now, there are some countries in the world that already have this software on their phone, and most notably China, and I think it is South Korea. It may be North Korea. Let me see if I can find that here. Hong Kong also has it, okay, and it says that governments can also require that these apps would tell us, let me start over here. Some international versions of the contact tracing technology expand mass surveillance, limit individual freedoms, and expose the most private details about the individuals, according to apps gone rogue, okay? Maintaining personal privacy in an epidemic is a report published by the Massachusetts Institute of Technology in March, okay? MIT. Risks exist for both the individual and the public with the use of contact tracing technology, the report says. The primary challenge of these technologies, as is evident from their deployment in the COVID-19 crisis, remains securing the individuals diagnosed carriers of a pathogen and local businesses visited by diagnosed carriers while still informing users of potential contacts. Additionally, contact tracing technology offers opportunities for bad actors to create fear, spread panic, perpetrate fraud, spread misinformation, or establish a surveillance state. Now, I don't want to live in a surveillance state. I'm not doing anything that anybody should be worried about, but at the same time, life, liberty, and the pursuit of happiness, right, is what I'm involved with, and I just really don't want people knowing all about my personal history. Okay, I'm just saying that. There's nothing that I'm ashamed of. I'm not carrying anything, I'm not sick with anything, but that's really none of your business, okay? I'm just saying that. It says those diagnosed with the virus are at the greatest risk of their privacy being violated by public identification. An example from South Korea stands out. The report states that information was sent out by the state's government to inform residents about the movements of those recently diagnosed with COVID-19, sparking speculations about individuals' personal lives, from rumors of plastic surgery to infidelity and prostitution. So while I'm not really involved in any of these things, still, I don't want the government sending out information about my personal life. And so this is something that is a very real threat, according to the MIT, Massachusetts Institute, to these real threats with this COVID-19 tracing app. So you want to be very, very careful. And if you choose to do this, you want to do it with your eyes wide open, okay? So am I concerned about the virus? No, I'm not particularly concerned about the virus. Why is that? Well, I don't have any kind of comorbidities. I'm not obese. I don't have heart disease. I don't have lung disease, and I don't have cancer. So my immune system is good. I do things to work on my immune system. Remember, I told you in past videos that we do have software here where we can do DNA hair analysis that will tell you what is the strength of your immune system. So if you need to strengthen your immune system to go forward, then that's something. We've got the technology to do this. I have done that. My immune system is very, very strong. Now, I also take, what do I take? I take vitamin D every day. I take wild oregano oil every day, not essential oil. Okay, this is not essential. This is in a little gel cap. It's from a different part of the plant, but it is a broad spectrum antibiotic and antiviral. I do that every day. I take vitamin C on most days, okay? So I protect my immune system, and my immune system is on alert for viral pathogens, so I'm not worried about it. Now, I'm not gonna go into a busy place. I'm not gonna get on an airplane. I'm probably not going to go to hotels and that kind of thing, simply because I don't want the hassle of the exposure on an airplane. I mean, airplanes do the recycled air anyway, so even when there's not a pandemic going on, you're very, very susceptible to getting something because they're recycling the air. So I protect myself when I do fly, and I have flown, and I've never been ill. Why is that? Well, I take liquid silver. I take a spoonful before I get on the aircraft. I take a spoonful when I get off the aircraft. I take it when I'm in the hotel, because there's just, you don't know who's been there before you. So I do a lot of preventative things, so I'm not worried about it. But right now, when they're having this mask mandate, I don't want to do that. I'm not participating in that. Y'all might send me hate mail, and I apologize if y'all do. But I'm really responsible for my own health. I'm responsible for my family's health. Everybody is responsible for your own health. If you are ill, you do need to stay home at this time. If you're not ill, you have more freedom, but you need to be smart about it. Some people feel comfortable with a mask. I particularly do not. I feel like it hampers my breathing. I feel like it's just not sanitary. And so, because I'm not in a surgical ward operating on people, and that's what these masks are for, they are to protect the open wound of the person being operated on from any saliva or whatever from the surgical staff. That's what masks are for, and in that scenario, they are appropriate. I do have a report here about masks, and this is written by a doctor, by a medical doctor, and he says that face masks pose serious risk to the healthy. Okay, I am healthy. Am I perfectly healthy? Well, probably nobody's perfectly healthy, but I'm healthy, and so I want to maintain health. I deal with sick people all the time. right? And I will just tell you, this week, everybody's come in with a mask on, and I ask them if they're contagious. I ask them if they've been diagnosed with anything, and they say no, but they don't know what to do, so they're erring on the side of caution, but they're very uncomfortable. And I just give them permission not to wear the mask in my office. Again, don't send me hate mail. I'm probably not going to change my mind, okay? But if you come and see me, I'm not going to make you wear a mask. If you are sick, if you have been tending to someone with COVID-19, then you should be wearing a mask, okay? But if you are healthy and not, then the CDC says that you should not wear a mask. I don't know why we have all the politicians and all of the news media telling us that we need to be masked, because that's not what the CDC is saying, okay? Or at least the last time I looked. Now, this particular article, as I said, comes from a MD, and it says, with the advent of the COVID-19 pandemic, we've seen a number of medical practices that have little or no scientific support as regards to reducing the spread of infection. One of those measures is wearing facial masks, either the surgical type mask, handmade, or the N95 respirator mask. When this pandemic began and we knew little about the virus itself or the epidemiological behavior, it was assumed that it would behave in terms of spreading amongst communities like other respiratory viruses. Little has presented itself after intense study of this virus and its behavior to change the perception. However, it says this is somewhat of an unusual virus in that for the vast majority of people infected by the virus, one experiences either no symptoms, asymptomatic, or very little sickness. Only a very small number of people are at risk of a potentially serious outcome from the infection, mainly those with the underlying serious medical conditions in conjunction with advanced age and frailty, those with immune-compromising conditions, nursing home patients nearing the end of their lives. And I have to say, all through this thing, it says that if you are elderly, 63 or above, you're elderly. And I just can't get that through my head. I'm just saying. So all of us who are in that age group, I think of elderly as someone who is infirm, someone who's taken lots of medication, somebody who may be in a nursing home. I certainly don't consider myself elderly, although I do fit in that age demographic, okay? So I want to look at two reports. I've got this report and this report, lots of statistics here, okay? This is dated July 4th, the week ending July 4th, which was last week, okay? I didn't have anything this week, but as of last week in the United States, right, the total number of deaths was 230 that was attributed to COVID-19. Now, if you look up in April, it was, for the week ending April the 11th, it was 5,989. April the 18th, 16,877. April the 25th, 15,189. And then every week thereafter, it gets lower and lower and lower until last week in the whole United States, there was only 230 deaths from COVID-19. And this is a report by the CDC. So we're hearing all over the place that there are more cases, more cases, more cases. And yes, I have to believe that that is true. But what I want us to understand is that the mortality rate is decreasing. And I have read, and of course you can read all kinds of things, but I have read that this is a very rapidly mutating virus, and that as it mutates, it gets weaker and weaker and weaker. And so the virulence is much less than it was earlier in the season. So I want to put that in perspective. And this is a report that says CDC confirms extremely low COVID-19 death rates. Now, we're here in the Houston area, okay, And on the news this week, Dr. Mark Siegel, who is a well-renowned medical doctor, and he said, yes, in Texas, we are having some issues with the hospital, but it is not because of COVID-19. It is because of all of the other procedures that people are trying to get caught up on because they've not been able to do elective procedures because everybody's been homebound during the COVID-19. In fact, yesterday, our governor stopped again the elective medical procedures because they want to make sure that if we have a spike of people needing to be hospitalized, that there would be beds available. So you have to look not only at what the talking heads tell you, you need to look beyond that and get the full story. Yes, we're having a whole lot of hospital activity, but it is because people are getting back on track with their screenings, they're getting back on track with their elective procedures and that kind of thing, not because of COVID-19. So that's something that we really want to understand. And in this particular report, it says that the overall proportion, this is the best estimate, and I think this was early June, okay? The best estimate that COVID-19 mortality rate, right, was 0.004% of the world population. Now, just to give you some perspective in that, okay? When we had the Black Death or the bubonic plague, right, it killed 60% of the world's population. And that was in the 14th century, so none of us were alive at that time. 60%, that is a huge, huge percentage of people that died from this malady. So this was taken very, very seriously. It should have been taken seriously. Even though we're using the same words, plague, pandemic, it's not affecting 60% of the population. And the mortality rate is definitely not 60% of the population. People are likening this pandemic to the 1918 Spanish flu pandemic. Now, that was much, much less virulent than the Black Death. The Spanish flu only affected, mortality rate now, 3 to 5% of the population. Not 60%, okay? 3 to 5%. So that's a whole different ball game. Now here we are with the coronavirus, right? And the statistics that I found as of July 7th, so that was a few days ago when I was looking at the statistics, it was 0.006, okay? That's the world population mortality for this virus. So when you put things in perspective, we're not dealing with something that is massively lethal. Have people died from it? Yes. Unfortunately, people have died from it. There are all kinds of graphs. Go do your own research. Look at the number of people that die every year from cancer. Look at the number of people that die from a car accident every year compared to who's dying from COVID-19. And you're going to see that you have very, very little risk. Now, do we just throw caution to the wind? No, I'm not saying that. I'm saying don't get all wrapped up in fear. Don't get all wrapped up in, oh my God, what if, because that damages your immune system. And so we know we have pathogens in the air. We know that there are sick people that we run into. If you go visit somebody in the hospital, if you're a Christian, you've got a hospital ministry team at your church that goes and visits people in the hospital. We don't want to stop that. Why? Because people who are sick need people to come and encourage them. Why? Because it's good for their soul, it's good for their immune system, it's good for their spirit, it's good for everything about them. So we want to make sure that we do this, and we do this with a very, very sound, we do it intentional. We're not just running around like chickens with our head cut off because we're afraid, okay? So let me get back to my report here. It says, as for the scientific support of the use of face masks a recent careful examination of the literature in which 17 of the best studies were analyzed, it concluded that, and I quote, "None of the studies establishes a conclusive relationship between mask, respirator use, and the protection against influenza infection." Okay? Keep in mind, no studies have been done to demonstrate that either a cloth mask or an N95 mask has any effect on the transmission of a COVID-19 virus. Any recommendation, therefore, have to be based on studies of influenza virus transmission. As you have seen, there is no conclusive evidence of their efficacy in controlling the virus transmission. All right? It says the recommendation by the CDC and the WHO is not based on any studies of the virus and have never been used to contain any virus pandemic or epidemic in history. So, those are some things that you need to look at to weigh up what you want to do there, okay? It says there is a difference in the N95 respirator mask and the surgical mask that's made of cloth or paper in terms of side effects, all right? And this is what I want to kind of hone in on, because if I'm going to be doing something, I want to know what are the side effects for me. And we all have to do that because we all individually are responsible for our own health. I will just tell you, if I had COPD, if I had leukemia, if I had congestive heart failure, or anything like that, I would not be going out. I would not be going out with a mask. I would not be going out at all. Because why? I would be very, very much at high risk. If I was obese, all right, that is having a body mass index greater than 30, okay? I think it's a little bit, you got a little bit of a leeway there if you're a guy. But if you're a lady, if you have a body mass index higher than 30, you are considered by the medical profession obese. You are at greater risk. If I was a diabetic, I would be at greater risk. I would stay home, okay, because my immune system is already compromised. That is not me. If I was sick, I'm going to take medicine. I'm going to look at the side effects. I'm going to make a decision based on what I need to do, whether those side effects are worth the benefit of the medication or not. Sometimes they are, sometimes they're not. Full disclaimer, I'm on no medication, so I don't have to make that decision, all right? So when we're talking about these masks, we're talking about the side effects, right? That's what I'm concerned about. It says there is a difference between the N95 respirator mask and the cloth mask. The N95 mask filters out 95% of the particles with a median diameter of greater than 0.3, and then it's got some kind of a I think it's micrometers, I think it is what it is, because it impairs the respiratory exchange, breathing, to a greater extent than a soft mask. It is more often associated with headaches. In one study, researchers surveyed 212 healthcare workers, 47 men, 169 females, asking about the presence of headaches with the N95 mask due to duration of use. Okay? The headaches, right? Do they have headaches? Do they have pre-existing headaches? They found that 1/3 of the workers developed headaches with the use of the mask. Most had pre-existing headaches that were worsened by wearing a mask, and 60% required pain medication for relief, okay? And this is what I want you to hear, okay? The bulk of the evidence points toward hypoxia, which is a medical term for low oxygen. I'm trying to read my page numbers here to see that I don't get out of balance with my page numbers. Hypoxia as a great side effect here. It says this is a reduction of blood oxygen or the elevation in blood level of carbon dioxide. It is known that the N95 mask, if worn for hours, can reduce the blood oxygenation level by as much as 20%, which can lead to a loss of consciousness, as happened to the hapless fellow driving around alone in his car wearing an N95 mask, causing him to pass out and to crash the car and sustain injuries. Okay? A more recent study involving 159 healthcare workers aged 21 to 35 years of age found that 81% developed headaches from wearing a face mask. Some had pre-existing headaches and were precipitated by the mask. All felt like the headaches affected their work performance, right? No one is telling the frail, the elderly, and those with lung diseases such as COPD, emphysema, or pulmonary fibrosis of the dangers of wearing a facial mask of any kind, which can cause a severe worsening of lung function. This also includes lung cancer patients and people who have had lung surgery, especially with partial resection or even removal of a whole lung, okay? Now, this is what's important. When you breathe, and I'm skipping a lot of this because I only have 5 minutes. When you breathe, you have a mask and you're breathing into that mask, you are exhaling virus particles, you are exhaling bacterial particles, you are exhaling carbon dioxide. If you have a mask and it's a tight mask, you are then rebreathing, okay, those pathogens. I'm just going to tell you, if you're wearing a mask for a long period of time, you're rebreathing that. And this is what is frightening. It says newer evidence suggests that in some cases, the viruses can enter the brain. In most instances, it enters the brain by way of the olfactory nerves, the smell nerves, which connect directly to the area of brain dealing with recent memory and memory consolidation. By wearing a mask, the exhaled viruses will not be able to escape and will concentrate in the nasal passages, entering the olfactory nerves and traveling to the brain. So this is what I'm really concerned about, because I do not want virus particles going into my brain. Yes, we have a blood-brain barrier. Normally, you know, the skull, all that protects that, but you've got your nasal passages that go right up in there. I've seen reports, I don't know if this is true. I've asked different doctors and they say it's possible true that when they do that COVID-19 test and they push that Q-tip way up in there, that they could actually rupture the sinus cavity and actually introduce pathogens into the blood-brain barrier. I don't know that that's a true thing. I have not researched that. I'm concerned about that, but I'm really concerned with these tests that are showing that if you're rebreathing the virus particles, that can be transmitted up into the brain. We do not want that. So what do you do, because this is like the $64,000 question, what does this do if masks are mandated in your area? Well, I'm going to put in the comments the actual order from the governor here in the state of Texas. If you're not in the state of Texas, you're going to have to look at other orders, okay? An order is not a law, okay? In the state of Texas, laws are passed by the legislative body, okay? The legislative body in Texas is not in session this year. So we do not have a law. We have an order. We have recommendations, but if you'll look at the recommendations, it says we would like you to do this unless. Now, the unless is if you have a medical condition. The unless is if you are in a bank. The unless is there's just several different things that are unless. So there's just a lot of gray area in the order. Now, if you are sick, you should not be going out, okay? If you are well, you are going to have to look at the research and you're going to have to decide for yourself if it's better for you to wear a mask or if it's better for you not to wear a mask. If you have medical conditions, you need to take the order, you need to highlight what you need to highlight, and you need to carry that with you so when you are asked, you have documentation, blah, 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 okay? So, true life. My husband went into the bank this week. He has a medical condition. He does not wear a mask. The security guard told him he needed to wear a mask. My husband was not prepared with paperwork, but he told the security guard at the bank, I have a medical condition. I'm not going to wear my mask. I have one. If someone comes close to me, I will cover up, but okay. So the guy did not hassle him. It was all good, but my husband did go by the next day with the order from the governor with except in a bank. You do not have to wear a mask in a bank. Well, that makes sense to me. Why? Because bank robbers do what? They wear a mask. Why do they do that? Because that's what they do. So the order specifically says in a bank you do not have to wear a mask. So I'm going to scan this. I'm going to put this in the comments. If you're in Texas, it's going to give you a lot of information. Please think for yourself. You are responsible for your health. I am not responsible for your health. The government is not responsible for your health. The government is doing the best that they know how to do. I don't know that they have thought all of this through because if they look at the statistics that I look at that says you're going to be more likely to be ill if you wear a face covering 24/7, I don't think that's what anybody wants. If you're looking at the news in the Texas area, especially in the Houston area, which is where I am, and it says, the media is saying the hospitals are overrun, yes, that is a thing. But look beyond the headlines. They're overrun because people are doing elective procedures, not because of COVID-19. Okay, and again, as of July the 4th, 2020, according to the CDC, deaths, involving COVID-19 is 230. So I'm going to leave you on that high note. It is the weekend. Get some sunshine. Be good to yourself. If you need help with your immune system, if you want to do that DNA and hair analysis, you can come in. You don't need an appointment. We just need 4 freshly plucked hairs. We'll scan it into the medical lab. They'll send you a report within 48 hours. You will know what your immune system looks like. You'll be able to take appropriate measures, and we're going to all get through this. I promise you. Thanks for joining me. Thanks for tuning in. I love you guys. Love you so much. Thank you for honoring me with your presence. Share. Facebook likes this when you share it. Tag your friends who may need some information, and I will get that order in the comments sometime today. It may not be in the next 5 minutes, but be looking for it. It'll be there today. God bless you. Love you. Have a great weekend. Be good to yourself and self-care. Bye-bye.